Peter Anna-Marie is a pharmacist, also a member, Association of Hospital and Administrative Pharmacists of Nigeria. He joins us from our Abuja studios. We'd like to thank you for joining us on the program. First, I'd like to begin by asking, what do you think about Cross River State? It continues to insist that it is COVID-19 free, but we've heard from public health practitioners who say that there is no state that is COVID-19 free in Nigeria.
Thank you very much for having me here. For any state or any part of the country to claim that there are no COVID-19 pandemics in their place, it has to be based on testing, on reports from testing. If they have tested enough and all the tests come out negative, we can believe them and we agree with them. But if they've not done enough testing to go around at least maybe 3/4 of the populace, and they are saying that the state remains free of COVID-19, then they still has to do more to prove to us that their claim is correct.
Now, looking at lockdown restrictions being lifted across the world, what kind of response should states put in place to avoid a spike in cases? For example, in a state like Lagos, today, the governor says SS3 students can go back to prepare August the 3rd. Would you say that the teaching staff, non-teaching staff, would you say that they're ready to go back?
Well, I think the government has to carry out investigations as to how prepared the school are and how prepared the teaching staff and non-teaching staff are before lifting the lockdown on schools or returning students to school. They have to be prepared. They have to be encouraged to keep to the guidelines set by the NCDC on hand washing, on hand hygiene, provision of hand washing equipment around the school areas before they will be able to come back and resume school. If they've not done this, then they need to prepare more before they can call the students back to school.
And you said part of the preparations is testing, but are you happy with the pace? Lagos, where the epicenter in Nigeria, is adjusting to its 1,000 tests a day, now aggressively expanding that capacity. But across Nigeria, we're at almost 150,000 in samples tested. Are you happy with the pace?
I'm happy with the pace of testing so far being carried out in the country. As we've been told, we have over 40 testing laboratories in this country for now, and the pace is good enough for us.
Nigeria recorded one of the highest recoveries across the country, 649 in just 24 hours. Looking at our treatment regimen, would you say that that is responsible, or perhaps the age bracket?
Yes, the treatment regimen so far, as we have observed, is good enough and is responsible for the large number of discharges that we're having. Now, you know that some people can even resist the disease too. So the treatment regimen being carried out in this country so far is good enough at all the treatment centers so far.
We appreciate your time. Peter Anna-Marie, a pharmacist, member of the Association of Hospital and Administrative Pharmacists of Nigeria. Thank you for joining us on the program.
Thank you very much.